Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. It was obviously an eventful weekend in Frankfort, and we'll be following up on WKYT News on air and online, and we'll see how things are shaking out next weekend on Kentucky Newsmakers. Later today, a look at the tight real estate market in Kentucky right now. We'll be talking with the Lexington Bluegrass Association of Realtors shortly. But first, the Kentucky Surgeon General, or the Surgeon General of the United States, was in Kentucky this week, fresh off his jarring advice in Atlanta that more people should be carrying Narcan around with them in case they run across somebody dying of an overdose. That's where we are as the opioid epidemic continues, and Kentucky is in the thick of it. Van Ingram is Executive Director of the Kentucky Office of Drug Control Policy. He's been with that office since it was formed back in 2004. Before that, he was a Maysville police officer, so he has seen the drug issue from all sides. Director Ingram is back with us on Kentucky Newsmakers. We really appreciate that. Thanks for coming in.
Glad to be here, Bill.
So I said you're fresh off coming back from Atlanta. Tell us about that conference. What were the highlights? Was there any reason for hope and optimism?
There's always reason for hope and optimism. People do recover. I meet them every day. The conference in Atlanta was great. You know, 7 years ago, Operation Unite in the 5th Congressional District started this. And I remember we were talking if we could just get 700 people there. There was over 3,000 people this year from every state in the country, and I believe 9 different countries. So it's really grown. Great speakers. Kellyanne Conway from the Trump administration was there. Bill Clinton was there. Spoke about the Clinton Foundation and their concern with this opioid epidemic. And just a lot of people who care about this problem and are committed to doing something about it.
It really was attention-getting when the U.S. Surgeon General, Jerome Adams, told the National Drug Control meeting in Atlanta that everyday Americans should be, or should at least consider, carrying naloxone around with them. Did he mean to suggest that virtually everybody in the country should have that drug available in case somebody overdoses nearby?
Well, look, Bill, over 150 Americans are going to die today of a drug overdose. Now, that's a preventable death, especially if we have naloxone and an opioid as the cause of that death. It's the defibrillator of our time. I hate it that it is, but you know, it wasn't that many years ago when it was kind of a new thing that we were putting defibrillators in public places. I was a police chief at the time and bought them to go in every one of my police cars. Just in case the ambulance didn't get there in time, we'd have a tool. That's what naloxone is. It's a tool. It's a good tool that can help save a life. The interesting thing about naloxone is if someone is not in an overdose, opioid overdose, and you administer naloxone, it's not going to do anything but give them a wet nose. It's not going to cause any harm. So to me, it's a no-brainer. I have it in my personal vehicle. I have it in my office. I would hate to think that someone would be dying and I had a way to reverse that and didn't do it.
If people want to do that, it is generally covered by insurance and they can go pick it up?
It's covered by Medicaid. It's covered by most third-party payers. We have a list on my, if you go to my website at odcp.ky.gov, you can find a list of retail independent pharmacies and chain pharmacies in nearby your community that sell it. It's an important tool that I'm hoping more and more people will embrace. You know, it was not too many years ago when we first started talking about this to law enforcement, there was some hesitancy, and now there's none. Law enforcement agencies across the state carry naloxone.
I know I have had this question come up. Are you taking some liability, you know, if you try to assist someone and you have the naloxone available?
Wisely, the Kentucky General Assembly, and when they passed Senate Bill 192 in the 2015 session, they created civil and criminal liability immunity for anyone administering naloxone in good faith.
The Surgeon General, while he was here in Kentucky, because after he was in Atlanta, he came to northern Kentucky, which has been an area of our state very hard hit. He talked about the impact of syringe exchange programs that are a local option in Kentucky, but many communities have those. Are those working?
They absolutely are, Bill. It goes back to Senate Bill 192, the same bill that gave us the naloxone, allowed for syringe exchange. Now, those have to be approved by the local Board of Health, the city in which they're located, and the county government in which they're located all have to approve that. With that caveat, I wondered how many cities would actually, how many communities would do it. We now have 45 programs in places like Pikeville and Boyd County and Nicholasville, Frankfort, and then our larger cities, of course, Lexington, Louisville. So they've really caught on. Research shows that if you're engaged in a syringe exchange program, you're 5 times more likely to go into treatment. We're seeing people referred to treatment every day out of these programs. Naloxone distribution happens at those programs. People get treated for abscesses, get tested for HIV and Hep C. There's a lot more goes on than just exchanging needles.
And of course, the early pushback to that was that it's the government enabling people. But do you feel that just as with naloxone, has proven to not be the case?
Well, I think we're meeting people where they are. We're taking a person who's probably checked out of the healthcare system and now they're interacting with a healthcare professional on a regular basis. And we're restoring hope and we're reducing stigma. Those are things we need to do to get people into recovery.
You know, we talk about a more coordinated strategy. That's been your job all these years. Obviously, nationally, we're trying to get that together at this point. And yet the numbers remain staggering. As you said, 40,000 people dying of these overdoses. Are we making progress?
We are, Bill. You know, for example, in 2011, 371 million dosage units of opioids was prescribed in Kentucky, was dispensed in Kentucky. Last year that was 301 million. We had a 70 million dosage unit reduction. So the policies that we're putting in place are working. They take time. I tell people all the time, the things we're doing today, we may not see the results of for many years to come because this problem is so bad. When we pass a law, when we put a policy together, everyone who has an opioid use disorder still has it. When we do a bill, the governor signs the bill, nobody magically gets cured. So we've got a lot of folks that have this disorder. It's going to take time, but we're making progress. Let me tell you about 2 things if I can. One is a website called Get Help Now, KY. It's a very interactive website. It's updated on a near daily basis by treatment providers as to their availability. You can locate a treatment provider, you can see what kind of insurance they take, what kind of treatment they provide, and it's a great resource for anyone wanting to make a treatment referral. Next, I want to talk about 833-8-KY-HELP.
Give us that again. That's a phone number, right?
833-859-4357, or KY-HELP. So this screening and referral service is operated for us by Operation Unite down in the 5th Congressional District. You can call there if you're in active addiction or you have a family member that is, and you'll talk to a social worker that'll be able to help you understand and work through this bureaucracy of treatment and explain to you what the different types of treatment there are. What is medication-assisted treatment? You know, what is an intensive outpatient program look like? They'll be able to walk you through all that and then help you make a better decision as to what might be best for you.
So many people tell us that their problem started with the prescription that was written by a professional, following the protocols of how they deal with a pain or an issue they might have. We know that there are efforts to educate the healthcare providers, including the doctors and the pharmacists, about being a gatekeeper. Is that working?
It is. There's much greater awareness on the part of prescribers as it relates to prescribing opioids. You got to bear in mind, for a lot of years, they were given a lot of misinformation. And it's taken time to turn that around. Our medical schools are now teaching a little bit differently as it relates to pain control and addiction. But these things are in place, they are working. We're doing a lot of physician trainings, and this Saturday, I believe, in Louisville, we're doing a training for dentists on opioid prescribing. We've done them for nurse practitioners. We'll continue to do that. You can watch our trainings at UKCE Central. It's an organization of the University of Kentucky that provides CE credits for different professions, and they tape our trainings and they're available online.
You had told us that there is a Senate bill that also requires and will in the future require discussion of disposal of medication.
Right, Senate Bill 6 passed in this session requires that pharmacists and practitioners that are dispensing medications have a conversation with the patient around opioids when they're prescribed about safe disposal. and provide products. There are products out there that will deactivate the opioid medication, and to at least have those available in the pharmacy for anyone who might want to purchase them.
Kentucky has really wrestled with incarceration versus treatment of drug addicts and those who possess illegal drugs. We know the Justice Secretary, John Tilley, has called for major changes that to some extent would decriminalize some of the possessory crimes. But there's a lot of pushback from that, from many who say they're breaking the law, they need to be in jail. Where are we in that debate?
Well, to use prison resources for someone with an addiction, with a disease, is probably not the best use of our resources. When they could be treated in a community, treating the disease is the most important thing for the addict. Punishment is just not going to work. Now, for the traffickers, for those people who are bringing poison like fentanyl into our community, I'm for locking those people up for a good long time.
Employers have problems finding enough applicants who can pass drug screenings. We hear that all the time. There some groups say we have 200 jobs and can't get the applicants. Are we missing something when it comes to people recognizing that even your job prospects and the other aspects of your life are at stake?
Well, we're encouraging employers to not overlook people in recovery, because they can be excellent employees. There's some restaurants here in Lexington that largely employ people in recovery. There's a factory in northern Kentucky that actually has 12-step meetings at work. So we encourage employers not to overlook this population that are recovering from this disease, because they can be fine employees for an organization.
Final question, are you encouraged where we are?
Well, I'll tell you this. CDC came out with a report a few weeks ago about visits to the emergency department from overdose victims. The national average was a 30% increase. Kentucky saw a 15% decrease over the time period reporting. So I think some of the things we're doing are paying off. It's not happening fast enough for me. We've still got way too many people dying. We've got way too many people overdosing, but we've got a number of other initiatives in place that I didn't have time to tell you about today. But yes, I'm encouraged. I think we will turn this corner.
Let me give you another minute. Tell me about a couple of other things.
Well, one of the things we're doing is partnering with the University of Kentucky Hospital System and U of L Hospital System and St. Elizabeth Healthcare System to do bridge clinics, where when people come into the emergency room with an overdose, we can induce them with buprenorphine and start a medication-assisted treatment program right there at that time. So they don't have to walk back out and go try to use again. We'll start you on a treatment regimen today. We're really encouraged. The first night we ran that program at the University of Louisville, emergency department, 5 people came in, 4 of them went into treatment. So we're encouraged that this kind of approach can work.
That's good. Thank you for coming. We really do appreciate it. Keep us informed, and we'll have you back as this is a long-term war. Thank you.
Thank you.
We are coming back on WKYT in just a moment. You'll meet the new man in charge of the Lexington Bluegrass Association of Realtors and a longtime Lexington realtor as well. We'll talk about those home trends out there in just a moment. We welcome you back to Kentucky Newsmakers, and we're glad you're here on WKYT. Despite what has been a tough dig out from a winter that just won't go away, home sales in Lexington have remained strong. The number of sales was down this quarter compared to last year, but inventory is very tight. Some say if you're not ready to move, be careful about putting that sign up in your front yard because your home may sell fast. Joining us to discuss buying, selling, and living trends in the bluegrass is Justin Landon. He is the brand new CEO at the Lexington Bluegrass Association of Realtors, and Ty Brown, a longtime realtor and immediate past president of LBAR. Gentlemen, welcome. We really appreciate you coming in today.
Thanks for having us, Bill. Thanks for having
what are your initial impressions moving to Central Kentucky, the housing market? You told me you're in the market for a house yourself, right?
We are, and I'm coming from San Antonio, where we have a very similar difficulty with lack of inventory, and coming in here to Lexington. My wife and I have been out looking for homes, and had a great weekend. We saw 40 houses in 2 days.
Wow.
Our realtors working hard for us, and we found 2 that we really loved, and of course they were under contract with somebody else within about 36 hours.
So you're finding that? I mean,
absolutely.
Absolutely. Things are moving fast.
They are.
Ty, no surprise to you. You know what the market is like right now.
Yeah, the market's really really tight, and it's particularly in the lower price points. And but everywhere, you know, the well-priced homes, good condition, are selling pretty fast. And you have to be, as always, we've talked before, you have to have a plan to be ready, buyers and sellers, and it's important to have that conversation with your realtor early, how to be prepared for the market right now.
What are the factors that that create that dynamic? The fact that the inventory is so tight.
Well, this time of year is always the busy time of year. You know, you always get people naturally moving. So the activity is out there. It's the same as it was, but for whatever reason, people have decided to not put their homes in the market. And in Fayette County particularly, there's not enough new homes coming onto the market to kind of replace the homes that are being sold. So it kind of bogs down the whole process from the top bottom, because there's just not a lot of new construction. And it's only going to get worse with the way the market is out there with what's available for building.
Is it a little bit like a domino effect in that people are afraid to put their house up because they don't know where they might go?
Yeah, the reality is what we see is that you probably can't buy the same home that you're selling for the same price, right? You can't find your next place to live in the price range that you're selling in. So it's simply a matter of supply and demand. You know, we are not building enough homes, and this is a nationwide problem. It's not just Lexington, but I think we have some exacerbated issues here. And until we get up to capacity where we're building enough homes to keep up with demand, we're going to continue to see tight inventory and increase sales price.
What are those exacerbated issues you mentioned? What are the things that are maybe a little bit tighter here than would be in other markets?
Well, every market's different,
Yeah.
And you know, if you look across the country, there are some cities that have plenty of land to grow out, and you know, here we've obviously got our urban services boundary that
restriction.
There are some restrictions on land development, and that is controlling the amount of land that's available to be platted and built on.
Is that causing people to move farther out? Is that one of the issues?
Yeah, I mean, counties immediately surrounding Fayette County are doing very well, and of course they're benefiting from it, and which is okay for LBAR in general, because we do cover 22 counties. But if you're talking Lexington particularly, that is driving people and builders who are doing it for a living just can't work here. There's just nowhere to build and work. They're going to Louisville and Georgetown and Richmond and Versailles, places like that, to make their living.
So I detect a little frustration, at least
Sure.
in Lexington, because of those restrictions.
Well, it creates it's an issue like right now. You know, affordability, housing affordability. We feel like LBR feels like it should be available supply of homes in all price, all levels of price. You know, you should be able, if you want to buy entry-level homes, you should be able to have a good supply of those. It should be out there. It's a natural market, and it's creating a situation where there really isn't. You know, that 200,000 and under, if you can find one. Is a tough market, which creates, again, that domino effect. To talk about the moving up. The person wants to go from the 150 home to the 300 home, can't, because there's nobody, there's no place to go. It just doesn't create that domino effect moving up. So again, it's a problem that's going to be probably continuing if we don't find a way to bring in some homes at an affordable level for people, because the median price point right now, the median price is about almost $200,000. And if you go average price, which probably a little bit reflects the market a little bit better, it's almost $230,000. So that's historically pretty high. That's not an entry-level price point here.
And yet everybody seems to agree that what makes the bluegrass so special is this green space and these beautiful horse farms.
Absolutely.
And I know if you have flown into Lexington, you know what a treat it is to see, right?
Yeah, I'm pretty sure they made sure to fly me in to Lexington for my interview, so I would get that perspective getting off the plane. And I'll tell you, it's tremendous, which is why striking a balance is going to be so important in this discussion. The answer isn't one way all the way either way. We've got to find a way to maintain that character of Lexington that has allowed folks like Ty to make a great living in this business, buying and selling real estate. But at the same time, understanding that this is housing opportunity is key in this country. The American dream is what we strive for. Home ownership, it's how the vast majority of Americans build wealth. And if we're not providing those opportunities here in Fayette, they're going to go somewhere else. And you know what? We want them here.
So in addition to the restrictions, there are personal tastes. And 20 years ago, people were moving to the country. They wanted that extra large backyard, maybe some room to grow. 10 years ago, the recession brought people back to the urban areas, scurrying in so they didn't have so much expensive travel and so forth. Where are the trends right now in terms of where people seem to want to be?
Well, people want, the houses are getting smaller, average size, smaller, more energy efficient. That's a huge trend. The two biggest groups of buyers, the millennials and the the retirees, baby boomers, both want smaller homes in places where they can walk to get something to eat, go to the grocery store, places like that. They don't necessarily want to commute in traffic all the time. And so it's gone away from being really close to work to being close to the place they want to live and have the community sense of feel. So those areas are doing fine, but homes in particular, smart homes are big. The energy efficiency, the big huge McMansions are kind of not in style for the two biggest buyer groups that we've got right now. So,
are the millennials prepared to buy homes? Are they coming around on that? It was talk they were big renters for a while. They didn't want the trouble of a lot of space.
I mean, we are seeing delayed home buying now. Folks are buying their first home a little later in life than they were in the previous generation. I think some of that's driven by later family formation as well. So it's not just driven by the sort of millennial personality that we hear about. And another thing we're a little concerned about in terms of that millennial buyer is historically one of the greatest tax incentives in our country is mortgage interest deduction, and the ability to deduct that on your taxes is why I bought my first home when I was 22. And today, we've now doubled the standard deduction, right? Which means that the vast majority of American homeowners are not going to be itemizing their taxes, which means they're not going to be claiming the mortgage interest deduction. And does that drive some buyer behavior a little bit? Are we going to see a little bit of a delay from that as well? I think it's entirely possible, which is why we pay so close of attention to all the regulations that happen both at the national, state, and local level, because it really does affect home buying behavior. Despite
the winter that won't go away, people have been out there buying, and you have some pretty good numbers, right? You pointed over to the weather office.
I see them over making the snow come over here, right?
That's right. But there's been a lot of that. But nevertheless, almost $500 million in sales in Fayette County. So the sales are strong.
Mm-hmm. Sales. Compared to what we were in a few years ago, you can't complain. But like I said, we do see that trend going down a little bit. Activity right now inside Fayette County for the year to date is down 12% in sales. And again, we think that's 100% almost function of availability of homes. And the prices are up 10% for the year in Fayette County. If you go outside of Fayette County, take the whole area, the sales are down 5%. But the prices are still up 10%. So people, again, that shows that they're maybe moving out of Fayette County to keep buying, and it's driving prices up in outer counties as well.
All right, gentlemen, been an issue going on here locally about a subdivision that made some very strong restrictions regarding dogs. And I want to ask you about restrictions when people move into new neighborhoods. We're going to come back with that in just a moment as we visit with the members of LBAR here on WKYT's Kentucky Newsmakers. We welcome you back to WKYT's Kentucky Newsmakers, and we're visiting this morning with Justin Landon, the new CEO of the Lexington Bluegrass Association of Realtors, and longtime realtor Ty Brown. And we're talking about home buying and selling trends in the Bluegrass. It's been a very interesting discussion. Should buyers think about, or at least be familiar with, the restrictions in a neighborhood when they go in? We've had this recent situation in Lexington where people are upset because certain breeds of dogs have been restricted. They didn't know that was a part of the rules. Some places don't allow fences and so forth. How are people to know what the rules are?
Mm-hmm. Well, deed restrictions and things like that are very important to create neighborhoods and that are protected, to protect your home values. That's what they're there for. But what a lot of people don't know, if they don't know that those things can change, and some people are not even aware that those things even exist, that are buying a home or buying a property that has some restrictions that limits what they can or can't do at their home. So that's why it's very important to have a professional, have a realtor, and ask them about those things and get those restrictions. They have to be recorded, they are available, public record, and see what you can and can't do so you know that going into it. Because they can be enforced and they can change.
You told me, strangely, Kentucky law does not require that those rules be given to new buyers.
I hear quite often that people had no idea. It's not easy to find and to do it on your own. I mean, it's something that realtors know how to get, know how to find, but it's hard to do if you try to do it by yourself, because there's no uniformity in any homeowner associations or neighborhood associations. They're all different. And some have websites, some don't. Some are recorded, some aren't. So it's just, it's important to have that conversation with a professional realtor.
Justin, does that all come as a surprise to you coming to Kentucky? I mean, would you potentially see that as some legislation that should be looked at?
Oh, potentially. You know, I think in many states, things like homeowners associations and deed restrictions and covenants that are made by communities that want to come together and say we have a common interest to protect this area for whatever reason. You know, it can be as specific as dog type or as general as you know, we're going to have fences or not have fences. And so in many states, those are required to be delivered as part of the real estate transaction so that buyers are put on notice. But again, you know, even in places where it is required, oftentimes they are not delivered unless the realtor is really working hard to chase those documents down, because too often, especially in a market like we've got here with tight inventory and homes moving really quickly, we're trying to rush through the transaction because we've got to get it done because it's such a competitive marketplace. So you really want to make sure you have a real professional working on your behalf.
And so people should really look over those documents and not just, you're given a pile of paper. I mean, how many people think, okay, we're going to do this quickly and get into our new home? They let the excitement overrun the details. You have to be careful in that regard.
And most realtors work in certain neighborhoods or at least familiar with it enough to let them know that it's an issue if they do want to explore it more.
Few seconds left. What do you say to people who want to put up that for sale by owner sign in front of their house and do it themselves?
Be careful. Well, first of all, don't do it, but be careful because it's a very complicated transaction, and it's a big transaction. It can affect people's lives, good or bad, either way. And you know, it's something that I think it's very important to consult somebody to do as a professional.
All right, Justin, you're going to find a house soon?
I sure hope so. We're working hard to do it.
Thank you for joining us, and thank you for being here for this edition of Kentucky Newsmakers on WKYT. I'll see you bright and early this week on WKYT This Morning. We start at 4:30. We're up when you're up, and you make it a good week ahead.